Okay, 6 o'clock. All right, let me make sure this is going on Facebook and the audio is going well. Yep, looks like it's in there. Okay, so open office hours. So this week I am going to talk about thyroid-gut connection. But I wanted to do two announcements first before we get started. One is I will have open office hours lecture next week and then June 7th, but will not have one during the summertime, actually, the rest of June and July, because I am going to be doing workshops this summer with a pharmacy in town, with a chef. I'm going to be doing all kinds of cool workshops. Now, they're going to be free workshops, so I will make announcements on the Facebook group about where they are so you can register. But I'm going to be doing that. I still have my open office hours, the Zoom link for those that are in my practice that just want to pop on and ask me questions, but I won't have this lecture style during the summertime. Okay. All right. So what are open office hours? So at 6, I do just an educational style webinar, different topics. People will usually email me or post in the Facebook group topics that they want in particular to talk about. That's actually how we got this one today. I saw 2 patients with hypothyroidism or Hashimoto's, and they wanted to discuss how do they fix their gut. And then after that, at 6:30, there is a VIP support for members in my practice. So if you are a part of my medical practice, you can pop on to the Zoom link, and I'm just there for open office hours, just like you would, pop into your doctor's office to ask any questions that you might have. All right. So the only thing is that I just ask that we don't record it on the Zoom. We record it here, but we don't record the open office hours with the members because this is for your chance to have privacy to ask questions that you need to and just be respectful of other people's time and other people's conversations. And why do I do this? Well, it's really about sort of allowing or giving people really information about how integrated medicine can help. And so it's really about other women in the community to help support each other. So my ideal model of healthcare includes health visits by doctors, ancillary staff like chiropractors and acupuncturists, community, and then ongoing learning like now. So let's talk about the gut-thyroid connection. Last week, if you missed last week, I talked about my holistic approach to Hashimoto's and why I sort of see it differently than most OBGYNs who are treating women with Hashimoto's. And I talked about in that particular lecture, I actually talked about several different things, but one, first, finding the root cause of why someone has thyroid symptoms. Is it inflammation? Is it their gut? Is it the wrong medication? Like, what is the actual reason why they're still continuing to have thyroid problems? Thyroid symptoms, I should say. 2, the right medication. So not every medication is right for everybody. So some people, Synthroid works just fine. Other people need to be on combo medications that have T4 and T3. The next step is about diet. And so we're focusing on the right nutrition, the right gut health for women with Hashimoto's. And then I did mention in the last lecture as well, different supplements. So if you missed that one and you really want an overview of Hashimoto's, then check it out in the Facebook group, or all of these lectures always get streamed on the YouTube channel, on my YouTube channel. So it's Well Woman MD. So you can see all of them if you just want to go through them all as opposed to having to scroll down in the group. So just again, symptoms of low thyroid, there are a ton. The really common symptoms are constipation, depression, weight gain, hair loss, and extreme fatigue. But there are a lot of really less common symptoms of thyroid problems. Skin conditions like rashes or worsening of someone's eczema, joint pain, daily headaches, migraines, even things like bladder incontinence can be symptoms of a thyroid that's not working correctly because of the autoimmune component. Oh, sorry about that. And that's because thyroid actually has a lot of jobs. Thyroid hormones in our body not only manage metabolism, so help us figure out what our metabolic rate is to just survive, but also in the gut, primarily, they have the job of helping to absorb nutrients from food. So when the food is broken down by the bacteria in the gut, it actually helps absorb these nutrients. The thyroid hormone also affects the production of our sex hormones, hence why women with even subclinical hypothyroidism can have infertility. And so it does, because it's secreted from the same part of the pituitary gland, you can have dysfunction in someone's periods. Actually, it's a very common symptom. Women have irregular periods. And it certainly affects your sleep patterns and also your energy, or how much ATP is being produced by your cells. So I talked about this last time too, that what we think Hashimoto's is you have the genes for autoimmunity in general. It doesn't necessarily have to be the thyroid, but you have the genes for an autoimmune disorder. And then it's either an environmental trigger like a toxin or heavy metals, or there's a ton of different triggers that can happen, or a leaky gut situation. And together it sort of turns on the genes. And so then you get an autoimmune disease. And Hashimoto's just happens to be one of them. There are several different types of autoimmune diseases. Hashimoto's is primarily affects obviously the thyroid gland, but there are other autoimmune disorders like rheumatoid arthritis or diabetes, lupus, EDS. I mean, there's a lot of different autoimmune issues. So the overall concept of why people get them is that they are genetically predisposed, and then something turns those genes on. Usually it's a gut issue, but sometimes it can be an environmental trigger or a toxin or heavy metal that ultimately turns their genes on. And so this is kind of just a summary from last time when I mentioned the 5 steps of my integrative approach for Hashimoto's. And that's first, testing for the cause; 2, finding the right medication for you, whether or not it's Synthroid or a combo; diet, that's what we're going to talk about today; eliminating toxins; finding the right exercise and stress management. These are all lifestyle techniques. And then making sure you get the right supplements that support the thyroid. There are 7 key nutrients that you need to have in your diet in order to support your thyroid. And if you're not actually eating those, or I'm just say eating, but you're not actually getting those through food, then you need to supplement them. And I'll mention those 7 nutrients as we go through this. So how does gut health impact the thyroid? What is the connection exactly? So your gut actually has to absorb nutrients to make thyroid hormones. I think this next slide, I didn't put it back in here, but last week I talked about how the conversion of first of all, from TSH being released to the thyroid to tell the thyroid to make T4, and then the conversion from T4 to T3 all require nutrients. Certain vitamins and minerals that you have to do to produce those thyroid hormones. Well, if your gut needs to absorb those nutrients in order for you to be able to effectively make the hormone, 70% of the immune system is also in the gut. So your reaction, or the way your body attacks the thyroid, is actually regulated by the gut. If you think of 70% of the reaction that you would have towards your thyroid is because of what happens in your gut. In the gut, actually, there is about 20 to 25% of T4 is converted to the active T3. 60% of it's in the liver. So actually in the gut tissue, in the gut cells, you actually have conversion of T3 to the more active T4 to the more active T3. So if you don't have proper gut function, then certainly you're going to have less T3 made, which is really the active hormone. And this relies on different enzymes, particularly bile acids are actually converted to secondary bile acids in the gut, which increases that enzyme activity. So if you have less good bacteria in the gut that are actually doing those particular functions, that are converting T4 to T3, or actually making the enzyme to help convert that conversion, then you're not really going to get the proper, you're not going to actually get the proper nutrients that you need to continue to make thyroid hormones. This comes up because there's a very big association between women who have Hashimoto's and who also have SIBO or IBS. So SIBO is kind of I consider it, a lot of people consider it a spectrum of IBS. IBS, irritable bowel syndrome, is really can be characterized by alternating constipation and diarrhea. People typically have multiple GI symptoms, and SIBO is kind of an extreme version of that because the actual bacteria in the gut are kind of more of the less helpful type of bacteria. And so with eating, they actually have significant bloating. They feel very full. They oftentimes get worse when they eat certain foods. So SIBO is kind of a spectrum of IBS. And it kind of makes sense. If your gut is so critically important to actually your thyroid hormones being produced and to be actually useful in the cells in your body, then women who have gut health issues often will also have IBS or SIBO. So you do see about a 40% chance that women are going to have IBS or SIBO with women who have Hashimoto's as well. It's all sort of based upon this, how the gut really impacts how we make our hormones. This is a cool slide. I like this one because you can kind of look at, these are all different triggers, right? There's toxins, there's bacteria that don't belong, there's gluten. And what happens is these sort of antigens cause you to make more zonulin. Zonulin is this little chemical that essentially makes a gap between these cells. These are cells in the gut. And when that happens, it allows leaking. That's where you get this word called leaky gut, where leaking and food and antigens and different bacteria that are not toxins and are not supposed to go through here actually leak into the blood system. It also causes inflammation. So those cells also become more swollen and they have an inflammation reaction and they do become even more leaky. And when that happens, your body actually mounts an immune response because it says, this is not supposed to be here. I'm not supposed to have these particular things crossing between these junctions. And so you develop antibodies, you tell your body you're sort of in a inflammation cascade. And so you release a lot of cytokines and interleukins that actually cause more pro-inflammatory markers. And so you can see where with these things floating down in your blood, essentially they can attack any part of the body, but particularly the thyroid, because the thyroid actually has a lot of the same receptors that look similar to what you see in the gut. And this is this gluten phenomena, which I'll mention in just a little bit about why I particularly think, and I'm not the only one that thinks that someone with Hashimoto's, one thing they can definitely do is eliminate gluten. But if you get your immune system going and get it kind of fired up, then it's going to have a whole chain reaction with a lot of different things that can happen. Certainly it can make your inflammation worse, and certainly it can make your autoimmune condition worse. So we're going to talk a little bit about what you can do to sort of prevent this leaky gut phenomenon, and that's really what part of the Hashimoto's treatment. So I talked about the gut impacting the thyroid and particularly the cells in the gut. The other thing that is important is if you have a leaky gut and you have inflammation, then you're not actually absorbing any of these nutrients. And a slide last week when I talked about how selenium and zinc are critical for making thyroid hormone, they're also critical for conversion of T4 to T3, which again is the more active hormone, because your thyroid makes predominantly T4, and in your tissues throughout your body, it needs to be converted to T3. So if you think about your gut being inflamed and not really absorbing the vitamins and minerals it needs, these two critical vitamins can become deficient. And then you again not only have a problem where you're not converting the actual hormone in the gut, but you're also then not able to make enough T4. So it compounds the problem. And this just indicates again how your immune system can be triggered. I like this slide too, because this talks about long-term, if you didn't do anything, you continue to not address your gut health. A lot of women end up developing celiac disease where you have a severe allergy to gluten. And you can see where this, constant inflammation, constant leaking, constant immune response, like it just keeps going and going and going into this vicious cycle, and years go by, and then suddenly you develop celiac disease and you can't undo the damage that has happened in your gut. So I talked about how the gut impacts thyroid, but how does the thyroid then impact the gut? Well, if you have Hashimoto's, you know that constipation is a very common symptom, because the thyroid hormone actually affects motility. So how well the gut actually eliminates what's in it. So thyroid hormone, normal thyroid function is really important to keep the gut moving so you don't get constipation. It also is important in the production of acid in your in your stomach and your saliva. And so people will often have indigestion issues. So they have a lot of reflux issues with Hashimoto's, bloating issues, because they're not actually making the proper amount of acid to help digest the food that they're eating to break it down the way it should. Same thing happens in the liver and pancreas. They make less enzymes, and so less of that absorption actually occurs. So having proper thyroid hormone is really important for gut function. And I use the term gut, but I'm referring to, stomach, intestine, liver, pancreas, the whole system. I should call it digestive system instead of the gut. to be more proper. But you can see where people would have these symptoms, right? If women with Hashimoto's describe a lot of like reflux symptoms, bloating, constipation, you can see where the thyroid is critical in those functions. So having that and then also having a leaky gut on top of it will make all of these symptoms worse. And you can continue to have symptoms despite having normal thyroid labs and being on a medication that you need for thyroid. Oh, here's the slide that I was mentioning, was this T4 to T3 conversion. So, and these are the 7 nutrients that I work with patients in my practice and really try to emphasize in diet, which is you need B1, thiamine, you need B12. You also need iron. This comes into play when women who are vegan, we have to be careful with vegan diets and not getting enough iron. You need selenium, you need zinc, you need magnesium, and you need vitamin D. So those are the 7 key nutrients that you need, and you need to either get them in food or you need to use supplementation. And that can be a factor if you are on a particular diet. So, yeah, here's just a repeat of what I mentioned about how the thyroid impacts the gut. We talked about how the gut impacts the thyroid and now how the thyroid impacts the gut. So diet. So rarely in my integrated medicine experience do I tell people you should be gluten-free. But I do with Hashimoto's. And that's because, again, in the gut, in the cells in the gut, zonulin is triggered by gluten because when gluten binds to the receptors on the cells of the gut, they often increase zonulin production. Then zonulin is actually opening that gap between these cells, and ultimately you get leaking of the gut and you get things that should not be entering the cells. They enter between the cells and into the blood system, and the immune system then mounts a response. And part of this is for this phenomenon called molecular mimicry, where essentially, and why does it, so if you're getting an autoimmune reaction, why does it target the thyroid, right? This is the key part of it, is that the autoimmune reaction could target anywhere in the body, right? If you have an autoimmune reaction, it could have picked your pancreas. It could have picked your, joints. It could have picked anywhere. But particularly with gluten, it picks the thyroid because the receptors in the thyroid gland are very similar to the receptors that are in the gut. And so this is a phenomenon called molecular mimicry, where it thinks, your antibodies think, I need to attack those particular cells because this is the problem. This is what's causing me the problem. So in particular, it does start to attack the thyroid gland, which then causes, destruction of the tissue. And then you start getting this circle of autoimmunity issues in the thyroid, or Hashimoto's. And there's a lot of really, really interesting, I think if you're interested in sort of the deep science behind gluten and thyroid specifically, then Isabel Wentz is a pharmacist who has done extensive research on Hashimoto's. She is one of the very first pioneers in Hashimoto's protocol, which is about how to really look at the gut and the connection between gut and thyroid. So Isabel Wentz, Wentz. She's got several books on the connection between gluten and thyroid, and also just in general how to treat Hashimoto's with a integrative approach. And definitely gluten is a component. There's also a lot of cross-reactivity with dairy. So frequently women who eliminate gluten still will have symptoms, and then dairy is very common to have to get rid of. That's actually my personal story. I'm dairy-free and gluten-free because of my Hashimoto's and PCOS. The other things that can trigger reactions are things like soy and corn, although less commonly than gluten and dairy. And so really focusing on those triggers, you can get actual food sensitivity testing to see if you have those particular antibodies to gluten or dairy or corn. And you can actually do it that way, or you can just do an elimination diet and get rid of those particular foods for 4 weeks and then introduce one at a time back and see how you do. and you're looking for your Hashimoto symptoms and whether or not they're returning by introducing that food. And you would only want to introduce one food at a time, usually a week to 10 days, somewhere around there. And then, again, you want to focus on, if you're going to do the elimination diet, then you also want to focus on eating nutrient dense foods that have those 7 micronutrients that I mentioned, because those things need to be there to make proper thyroid hormone. Here, I just went through this again. I just wanted to show, here's a great diagram. I forgot I put this one here about zonulin. So again, zonulin is gluten is gliadin antibodies, or gliadin antigen is actually attaching to the cells in the gut. And then zonulin is being made. It allows this gap to go between, this is what we call leaky gut, or leaking of the tight junctions. Then you're allowing these proteins to come through that typically do not go through that. And then they're entering the blood system, and your immune system is mounting a response. I did want to mention something about this too. The one thing that I think people don't appreciate is that usually this takes time. So this is kind of one of to me, the things that lack in traditional medicine is we typically don't do a thyroid panel. We actually just do a TSH. Well, someone has to have clearly a lot of dysfunction of their T4, their T3, their thyroid antibodies to be high, and then their TSH will often go abnormal. And you can see this where I've tested patients who had normal thyroid, normal TSH, but they had elevated thyroid antibodies. And in fact, I just saw a patient in clinic a week ago at one of my hospitals that I actually see patients in, and her doctor had said, "Oh, you don't have Hashimoto's. There's no way you have Hashimoto's." It's like, the lady has elevated antibodies. That's not normal. You shouldn't have thyroid antibodies. In fact, when you look at her T4 and T3, her T4 is low, but her TSH is normal. So her doctor, who is an endocrinologist, chose not to treat her. And I think that's very bad advice, because she is the perfect person to actually prevent damage to her thyroid. Because if her antibodies continue to build and build and build, and it continue to destroy tissue in the thyroid and continue to attack the thyroid, eventually her thyroid won't be able to function on its own at all. She'll be on replacement for the rest of her life. So this is the perfect patient who should be thinking about how to prevent the destruction of some of the thyroid tissue and ultimately restore some of the function on her own. She may or may not be able to get off of thyroid medication. There was a recent podcast that I was listening to with a doctor who reviewed a study recently that showed that maybe 17% of people who are diagnosed with Hashimoto's can reverse their Hashimoto's if it's in that early stage where they have not had a lot of destruction to their thyroid and may not be reliant on medication for the rest of their life. I mean, how cool would that be if we could just reverse that? So anyway, get off my soapbox, right? So again, nutrient-dense foods that have selenium, zinc, magnesium, iron, and B vitamins. Definitely make sure you get tested for vitamin D. That's one of them that's in here. I didn't say this in particular because you need to have a test to know where you start and where you're improving on that level. The other thing that's important for someone who has Hashimoto's is making sure you get a lot of omega-3 rich foods and avoiding excess mercury and heavy metals that are in food. So these are like fish, making sure that you're not having too much. A lot of the fish now is high in mercury, so you need to be careful that you're not actually working against yourself. As for a particular diet, I will say that there is a lot of good data and research on a paleo diet. So I, for one, always talk to women about anti-inflammatory. That's a big category. You can put underneath that a Mediterranean diet, a paleo diet, even some vegan diets that are under that big anti-inflammatory umbrella. But paleo in specific there's been several studies that actually looked at paleo, and that just switching to a paleo diet, there was 2 studies that look at on PubMed that were looking at women between 80 and 85% of them had cleared most of their Hashimoto symptoms by simply doing a paleo diet. So I do think that there's there's definitely enough data behind sort of avoiding gluten and sticking to a paleo plan. Certainly you can stick to even more stricter option like an anti-inflammatory, like a Mediterranean diet. But ultimately, it needs to be that you're focusing on getting these particular vitamins and minerals in your diet. The next part of the diet is really nourishing your gut. So once you sort of get the right diet plan for you and right nutrition plan for you, you're getting all the vitamins and nutrients that you need. You got to heal your gut. Go back to the lining, replace. So your gut lining replaces itself every 2 to 3 days. So restoring that, getting that lining back to where it used to be, so that you don't continue to have the inflammation, replenishing it with good bacteria. That's probiotics. And there are particular probiotics that are better for women with Hashimoto's. And I think that's on I have a blog post coming out this Friday on Hashi, and I think I put that in there as well. And then and then focusing also on prebiotics, which is really the food for the bacteria. So you're going to, put the good stuff in, but you also need to feed it the right prebiotics to help make the normal essential fatty acids that you need. I put this slide in here from last week. Some people are on diets where like they may be vegan or they don't like certain things. So you can always get a lot of these in a multivitamin that has selenium, zinc, copper, and then obviously a B complex. These are just 2 brands that I particularly like. I think they're very clean brands. Both of these are pretty available. Vitamin B and vitamin D. This is a company I typically like, and I don't make any money on saying this, but so I have no disclosures. That's the word. So vitamin D, you need to make sure you get your levels checked. And vitamin B, a good B complex vitamin is great. That gives you that B1 I mentioned and B12 that I mentioned, both of which are essential for thyroid function. And then probiotics, I typically tell women that a spore probiotic is better. A spore probiotic actually makes it through the stomach. The stomach has acid and and those probiotics can be broken down by the time they actually get to the small intestine. Then a spore probiotic is a little bit more sustainable, a little bit better at getting to where it needs to go. And that also kind of goes to the other component, which I didn't put in this presentation, but it's important that I talk about, is that women who have a lot of this sort of reflux and bloating and digestive issues, digestive enzymes can be great. They help your body as your body is healing, especially if you have a lot of gut issue, is help your body digest proteins, fats, carbohydrates. So they're the digestive enzymes that you would normally make in your gut. But if you have an unhealthy gut and have leaky gut, then you're just not able to do it. So I often will put women on digestive enzymes, proteolytic enzymes, or just HCl to help them actually with their digestion as they're healing their gut. And there's a lot of different brands for that too, but it just depends on sort of what you need. Prebiotics, food is a great source of prebiotics. Remember, this is the food for the bacteria, but they also do sell supplements for prebiotics. These are just some examples of prebiotic foods. So in summary, these are kind of based on the functional medicine approach of Hashimoto's, which is, removing the 5 R's, removing the triggers, removing the things that are causing you to get a leaky gut. Particularly gluten is, I think, very necessary. And then you have the other food sensitivities and food allergies and other things that we were talking about, restoring the good bacteria back into the system, repairing the gut and the gut lining by nourishing your gut lining with prebiotics, and also trying to repair the lining in general. And then obviously everything you do is always about decreasing inflammation. If you have an autoimmune issue, you got to decrease inflammation in your body. And that part is a huge topic, but stress management is definitely part of that. Sleep is part of that. What you put on your body, endocrine disrupting chemicals and things that cause you to disrupt your hormones. I mean, a lot of that is sort of in that inflammation cascade. So an integrative approach. So I put this slide in here every single time. So what I do with my patients is I spend an hour, we do an hour-long visit every time, and we just go through a lot of what have people tried, what's going on, what is the history, what is someone's experience, so that we can kind of move on that experience and try to figure out what do we need to test for. And then we come up with a diet and exercise plan that's specific for their condition. And in this case, we're talking about Hashimoto's. So talking about how we can focus their diet on improving their immune system, because Hashimoto's is an autoimmune issue, stress management, adding supplements and herbs. And then really the ultimate goal is that you are your best healer. And so my job is to really help you uncover what you can to allow your body to heal so that you're not on medications, that ultimately we could get you off of a lot of medications and that you feel like yourself again. Okay, so this is the time where we pop over to the members only Zoom link. So if you're in my medical practice, you should have a Zoom link that you can pop over if you have any questions specifically about anything that I mentioned today, or you just want to talk about anything really. That's the point of what I do, why I do office hours, is just so I can support my patients in between their visits. Yeah, and then so 2 more weeks. So next week and the week after, I'll have 2 more topics. I think I'm going to talk about fatigue, maybe sleep. I don't know. If you guys have suggestions, throw them in the Facebook group or email me directly. I was thinking fatigue or sleep issues. And yeah, I hope you have a wonderful night, and I'll see my members over out in the Zoom link.